Hi, my name is Audrey Watkins-Kizee, and my presentation is on social work with children and adolescents with medical conditions. How is working with this population different? Working with children and adolescents with medical conditions can be a delicate situation. It can be stressful for all parties involved, the parents, the medical staff, as well as the children. Gillard and Brown suggests when parents feel overwhelmed and anxious to seek or get involved in individual or group counseling. Social workers also have to collaborate and facilitate services for the patient and the family. This includes interfacing with schools, medical personnel, and community organizations. Gillard and Brown. Identify and discuss two main challenges specific to this population. I believe one of the main challenges with working with children who have medical conditions is getting them to understand and accept their conditions. Oftentimes, children wonder why they have the condition and get frustrated about their limitations in treatment. If they can't play actively, things such like that. Another challenge is that the added stress for the social worker by them constantly working with children who are sick. In our text by Gillard and Brown, the degree of stress can be overwhelming for all parties involved, including the professional helpers. How would you, as a social worker, working with this group, address challenges? Social workers can try to help to explain the medical conditions to the children in an age-appropriate way. That may help them deal with it a little better, or if they understand it more. A younger child would need an explanation they can understand. Toys and pictures could be used to help. Adolescents may have a better understanding of their condition to a certain degree, and they may also have other options available to research, maybe the internet or using their school library and things such as that. Another challenge for the social worker would be managing their stress and avoiding vicarious traumatization. And they can do that by addressing their self-care. And some good self-care methods would be leisure walking or leisure activities in their free time that help them relax. That can help minimize stress. My favorite stress-reducing activity is massages. So that also can help reduce stress. Gillard and Brown suggest creating boundaries between work and home, seeking supervision from professionals, accepting limitations, and spending time with non-sickly children. These are things that can help avoid vicarious traumatization. What resources would you need as a social worker? As a medical social worker, you would need to have some knowledge of various therapies. I think some of the common ones would be CBT, cognitive behavioral therapy, trauma-focused therapy, play and expressive therapy, and a suggestion from my classmate from our week 5 discussion was narrative therapy. The social worker should also have some knowledge of local support groups and services within the area that they can try to refer the patient and the family to if they need help outside of the scope of what they can provide. Resources that children and adolescents with medical conditions will benefit from. Information explaining their condition, if you can find any like children's books, and of course for adolescents, any information that you can find, pamphlets, anything that you can give them that can help them better explain or better try to manage their medical condition. Resource foundations that may be able to help. Coping skills and relaxation techniques. Palliative and end-of-life care could be useful for certain patients that may be in that scope of the care. And self-efficacy. A cross-sectional study by Cram, Stratling, Roberick, and Niebuhr in 2012 suggested that interventions that help improve general self-efficacy should benefit the quality of life among adolescents with chronic medical conditions. How would you, as a social worker, distinguish yourself from others working with this patient and highlight your various skills aside from basic case management / discharge planning roles? As a social worker, I think it's very important to explain and try to answer any questions that the family may have about the medical procedures, and that will help reduce anxiety, especially for the children. A lot of times they're just afraid of being put to sleep or needles and things of that sort. I will make myself available to the family and form a relationship in support of, as well as advocating for services for them. A lot of times there may be things that the family need that they may not have or know how to gain access to. So as a social worker, you can be an advocate for them by calling various places or getting information for them. And of course, promoting self-efficacy to help improve positive outcomes of their medical condition. Again, the social worker would need various skills, which would be you would need to know how to engage in play therapy, CBT, cognitive behavioral therapy, trauma-focused therapy, and you should be able to teach or tell the child and the family how to manage anxiety techniques. Of course, great communication skills also help with working with the whole interdisciplinary team that's involved with the patient and the family. Once everyone is on the same page, things run smoothly, and things tend not to slip through the cracks. So communication is always key when you're dealing with patients and families and people in general. And there is my reference page. I hope you enjoyed my presentation. Thank you.